72 of them, 21 were pre-diabetic, that's 29.2%. 34 were diabetic, that's 47.2%. And the average BMI of severely ill patients, that's body mass index, is 30.7%. Tell us more.
That's a score of 30.7. And above 30, above 25, you're overweight. Above 30, you're obese. The more we see this disease, the more we understand that severe rapid COVID disease, especially, is in diabetics or pre-diabetics. We have, I'm looking at 19 or 20 patients that are intubated, and 18 of the 20 were intubated, or diabetic rather, and 2 are pre-diabetic. We don't have anybody that's been intubated in our group of over 80 now that was not diabetic or pre-diabetic that was intubated. We had severe disease. We've seen younger patients with severe disease that have a very high BMI. We have patients that are 150 kilograms, so I'm doing the math quickly, that's over 300 pounds. We're seeing a lot of this. And I don't understand, and just now I think the world's catching up to this. The Seattle group published on their data in the New England Journal of Medicine, saying that 58% of their ICU COVID patients were diabetic, and that their average BMI was 33, which is, morbidly obese. So that fits with our data, but what people haven't focused on yet is that the pre-diabetics are also at risk, especially if they have a high BMI. We haven't had anyone under 70 who didn't have a very high BMI or was pre or diabetic get seriously ill. This is amazing stuff, and it's unprecedented.
Yeah. So this means, Dr. Asqui, because you treat heart patients who oftentimes have other issues, high body mass index, also diabetes. These are potential comorbidities in this disease, but are risk factors for this disease. I don't know what the right terminology is, really quickly.
I think risk factors for poor outcome. I suspect Steve's data has probably shown that those with mild to moderate COVID infection and respiratory problems have a lower incidence rate than those with severe. Steve can speak to that, but certainly it goes again to the importance of weight loss, diet and exercise, because clearly those with diabetes and pre-diabetes are at much, much higher risk. As you know, last night we spoke about the CDC's finding in this regard, but I think Steve's work is going to be incredibly important.
And Steve, I know you're Go ahead, Steve, real quick.
Two things I want to get across on the treatment. We treat everybody with hydroxychloroquine and zithron. We've been doing so for a while. I was very nervous about the effects on the EKG, as you just spoke to, Roman. And I asked Dr. Dobesh, actually, to be my EP cardiologist looking over the EKGs, because it's been 30 years since I've done that. Dave has looked at over 40 of our patients that have received several doses, many doses, and he has found only 2 patients have had changes. In other words, and they had other drugs. Now, more importantly.
All right, hold that thought. We're going to keep it with our medicine cabinet there, but hold that thought.